This demonstration is about tracheostomy care procedure. After our student nurse knock and enter the room, she will then introduce herself, perform hand hygiene, identify the patient using two identifiers like her name, birthday, and medical record number. Then compare these identifiers in the patient medical record. Now's the time to tell the patient about the procedure. Don clean glove. Grab the tube. Connect one end of the connecting tubing to the suction machine. Turn the suction device on and set the vacuum regulator to less than 150. Let's go ahead and check the negative pressure of the suction apparatus by occluding the end of the suction tubing before attaching it to the suction catheter. Now's the time to check for any breathing difficulty. Assess the patient lung sounds. Encourage the patient to take 2 or 3 deep breaths. Check vital signs such as oxygen saturation and the patient's ability to clear the airway to make sure there's no need for supplemental oxygen. For instance, if the patient is starting around 95%, there is no need for supplemental oxygen. Now go ahead and discard the glove in the trash, and then gather all the equipment and bring them closer to the work area. Perform hand hygiene, put on some clean glove. Next, using aseptic technique, we are going to open the sterile catheter package on a clean surface. Let's open the trach care and the suction catheter kit, which we will be using as a basin later for the following procedure. And most importantly, make sure to not break sterile technique. If a sterile drape is available, go ahead and open it up, place it across the patient's chest or on the overhead bed table. Go ahead and pour the cleaning solution, in this case our normal saline, in the basin. Now it's time to suction the patient. Go ahead and discard the old glove, perform a hand hygiene, then put on some sterile glove. Follow the procedure of how to put them on as shown in the video. Now, using the non-dominant hand, grab the end of the connecting tubing. With the dominant hand, grab the end of the suction catheter. Then insert it in the suction tubing. Turn on the machine and test the suction with the normal saline solution. With the dominant hand, insert the catheter into the artificial airway until resistance is met, and then pull back 1 to 2 centimeters. Using the non-dominant thumb, depress the control vent of the suction catheter to apply continuous suction while completely withdrawing the catheter. If secretion remains in the airway, reinsert the catheter. Allow a minimum of 20 to 30 seconds between passes for the patient to recover before the next pass. Make sure to assess the volume, consistency, and color of the airway secretion. Notify the practitioner of changes in the airway secretion. Also, consider hyperoxygenating the patient with 100% oxygen for 30 to 60 seconds after suctioning. And make sure to return supplemental oxygen to the baseline level. Go ahead and discard all the items. Now it's time to perform trach care. Make sure to perform hand hygiene before putting on the sterile glove. Remove the inner cannula with your non-dominant hand. Then place it in the basin. Pour the normal saline solution. Then let it soak. Remember to keep the dominant hand sterile throughout the procedure. Grab the sterile brush to remove secretion from inside and outside the inner cannula. Then make sure to rinse it with normal saline solution. Replace the inner cannula and secure the lock mechanism. Let's clean around the trach. Remove your old glove, perform hand hygiene, apply sterile glove. Make sure to remove the drainage sponge. Use cotton tip swab and 4x4-inch gauze saturated with normal saline to clean the exposed surfaces of the outer cannula and the stoma under the faceplate, extending in all directions from the stoma. Clean in a circular pattern around the tracheostomy, from the stoma side outward. Using the dry 4x4-inch gauze, pat the skin lightly, as well as the exposed surfaces of the outer cannula. Apply a new drainage sponge. If necessary, replace the tracheostomy collar, the T-tube, or the ventilator oxygen source over the outer cannula. Now dispose of used supplies and equipment. Perform hand hygiene. Then, help the patient into a comfortable position. It's important to reassess the patient. Place personal item in the call button within reach. Leave the patient room tidy. Perform hand hygiene. For documentation, make sure to report the patient response, the assessment before and after care, and any expected and unexpected outcome.